Hi everyone, welcome to Embrace Your Menstrual Cycle. My name is Kerri-Anne and I am a naturopath, and I am passionate about supporting and educating women in their own health so that they can make empowered choices about their own health journeys. So today we're going to be looking at the basic anatomy uh, of the female reproductive system. We'll be looking at the 28-day menstrual cycle, and we'll also be looking at the key hormones and their roles. So this webinar is suitable for teenage women as well as an introduction into their menstrual cycle. Okay, so let's have a look at the basic anatomy of the female reproductive system. So this is a full image of where everything is placed in our reproductive system. So you can see the vagina down here leading into the cervix, the uterus, the fallopian tubes, the ovaries, and then the endometrium and the myometrium layers of the uterus, and we'll break each of those ones down. So let's have a look at the ovaries. So the ovaries are an almond-shaped glands, and they're located on either side of the uterus. So each ovary is about 3 to 5 centimeters in length, and they contain thousands of tiny sacs called follicles. So each of these follicles houses an immature egg. The function is egg production. So each month, typically one follicle will mature and release an egg during ovulation. And then at the end of the ovary, at the end of the fallopian tubes there, coming towards the ovary, is the fimbriae. And they are finger-like projections at the end of the fallopian tubes. They're covered with cilia, which are tiny hair-like structures that move in a coordinated manner. They're located near the ovaries, but they're not directly attached to them. Their function is when the ovary releases an egg, they capture that egg, and then the movement of the cilia on the end of the fimbriae creates a current in the surrounding fluid and guides that egg into the fallopian tube. After capturing that egg, the fimbriae then help propel it down in towards the fallopian tube, where it then can be moved down towards the uterus. And now our fallopian tubes, which are the two thin tubes on either side of the uterus. You can only see one in this image, but there is one on each side of the uterus. And these tubes are about 10 to 12 centimeters in length. They extend from the uterus to the ovaries, and their function is the transportation of that egg that has been released by the ovary. The fertilization site is usually within the fallopian tube. So this is where the sperm meets the egg. And if fertilization does occur, then it's called a zygote, and that resulting zygote then travels down that fallopian tube and into the uterus. The uterus itself is a pear-shaped muscular organ located in the pelvic cavity. It consists of 3 layers: the perimetrium, which is the outer layer, the myometrium, which is the middle muscular layer, and the endometrium, which is the inner lining. It's divided into 3 parts. So we have the fundus at the top, the body in the middle, and then the cervix, which is the lower part connecting it to the vagina. The function of the uterus is for pregnancy. So the endometrium thickens in preparation for the potential implantation of that fertilized egg. If fertilization does occur, then the fertilized egg implants into the endometrium. The uterus expands then to accommodate that growing fetus. It also provides nourishment and support to the developing embryo and fetus through the placenta. If no pregnancy occurs, so if that fertilized egg does not get implanted into the endometrium, then the endometrial lining sheds, and that is menstruation. Okay, so the endometrium, so that inner layer, It's composed of two layers in itself, the functional layer, which is the layer that thickens and sheds, and then the basal layer, which regenerates that functional layer. So this is where we need this area to be working beautifully to be able to accept and nourish that fertilized egg. It's very rich in blood vessels and glands, and its function is, of course, to support that egg. And also, it undergoes cyclical changes in response to hormonal fluctuations, and that's what's causing our menstrual cycle. And we'll talk a little bit more about the menstrual cycle and the hormones a bit later on. But that's what the endometrium does, is it either supports a fertilized egg or it sheds itself ready for a regrowth for next month's ovulation and egg. The myometrium is the muscular layer of the uterus, and that's responsible for contractions. So it's composed of smooth muscle tissue, and it has three different layers: the outer longitudinal, middle crisscross, and the inner circular muscle. And all of these muscles work together to contract to help shed the endometrial lining. And this is what can cause those menstrual cramps. And during pregnancy, it expands to accommodate that growing fetus as well. And then during labor is where it works to provide strong rhythmic contractions to help push the baby out. And then after delivery, the myometrium contracts to help expel the placenta and to reduce that postpartum bleeding. And the cervix, which is the lower narrow part of the uterus that connects the uterus to the vagina. It's cylindrical or conical in shape, and it measures about 2 to 3 centimeters in length. The cervix is a barrier protecting the uterus from bacteria and other pathogens that could ascend from the vagina. It also has cervical mucus, and so we notice those changes throughout the menstrual cycle depending on the hormonal changes and fluctuations, and we'll talk a little bit more about that later on. The cervix is also produces that cervical mucus to support the sperm coming in from the vagina. So it creates the perfect pH balance to support sperm. And during the time that we're less fertile, it creates an inhospitable environment for the sperm. So around ovulation, we'll see that mucus becomes more copious and stretchy and clear, and it's often described as egg white cervical mucus. And this is when we are most fertile, and it is an optimal environment for sperm survival and movement. So within the cervix, we have little crypts. They're little glandular structures in the cervical canal, and they can store sperm for several days, releasing them gradually to increase the chances of fertilization. The cervix is also there as a protective area during pregnancy. So when the egg is implanted into the endometrium and that layer doesn't shed, and we have an optimum environment for pregnancy, then the cervix forms a thick mucus plug that seals that cervical canal, protecting the uterus and the developing fetus from infections. It's also there for for structural support. So the cervix helps to support the weight of the growing uterus and the fetus. So as pregnancy progresses, the cervix undergoes physiological changes like ripening and effacement and dilation in preparation for labour. So the cervix is only this small little 2 to 3 centimetre in length part of our reproductive system, but it plays a huge role in protection from infection and supporting our pregnancy and fertility. Now, the vagina is a muscular tubular organ that extends from the cervix to the external genitalia, so our vulva. It measures approximately 7 to 10 centimetres in length, but it has the ability to stretch and expand. Now, our vaginas have a self-cleaning mechanism, so they naturally produce a discharge that helps to clean and maintain its environment. So this discharge removes dead cells and bacteria, keeping the vagina healthy. We also have a vaginal microbiome. So just like we have a gut microbiome, we also have a vaginal microbiome. And it's primarily composed of lactobacilli. And it plays a key role in maintaining the vaginal health by producing lactic acid and hydrogen peroxide, which keep the environment acidic and inhibit any pathogenic bacteria. Now, the phases of the menstrual cycle. So, we're going to go through each of these phases individually. We're going to start down here with the day 1 to 5, which is the menstrual phase. So, when you're having a look at this chart here, you'll see the days down the bottom. And then the second bit is the endometrium layer and how it thickens and sheds. Then we can see the cycle of the egg. And then above that, those lines represent each of the different hormones and what they're doing at each stage during our menstrual cycle. So, day 1 to 5 is our menstrual phase. And so, this phase marks the beginning of our menstrual phase. So when you're tracking your cycle, day 1 is the first day of your menstrual bleed. So if you have a day of spotting, that's not day 1. Day 1 is when you have an actual bleed. So this is when the endometrial lining, which has thickened in this previous cycle, is shedding itself because no fertilized egg has been implanted. So during this time, obviously, we have bleeding, which is that beautiful, magical endometrium layer being released from our body. So if you think of that endometrium layer and that menstrual cycle bleeding as that magical layer within our uterus that can help support life, you can see how magical that bleed actually is. You may feel cramping, fatigue, and mood changes throughout this first 5 to 6 days. Um, in this stage, we see estrogen and progesterone. Both levels are at their lowest during the start of menstruation. So it's the drop in progesterone that triggers the shedding of the endometrial lining. Also in this stage, the follicle stimulating hormone levels begin to rise. So this is preparing the ovaries to develop new follicles for the next cycle. So this is working towards fertility. This is the follicular phase. So if you look up the top there, you can see that the follicular phase is from day 1 to 13, and it begins on the first day of menstruation and continues until ovulation. So the pituitary gland releases follicle stimulating hormone, and that stimulates the growth of those ovarian follicles. So typically one follicle becomes dominant and prepares itself to release an egg during ovulation, which is day 14. In this follicular phase, the endometrial lining begins to thicken, again in preparation for potential pregnancy. Also, during this follicular phase, as the follicles develop, they begin to produce increasing amounts of estrogen. So you can see the estrogen levels starting to rise after the follicular stimulating hormone has started to rise. So the estrogen helps to rebuild the endometrial lining, making it thick and rich in blood vessels. So high levels of estrogen then provide feedback to the pituitary gland to reduce that follicular stimulating hormone production. And then you see it start to drop again just before the end of the follicular phase. Now, the luteinizing hormone, estrogen levels once those estrogen levels have started to rise, that triggers a surge in luteinizing hormone. When we move to day 14, we can see that's our day for ovulation, so about halfway through our cycle. And an ovulation is the process where the mature egg is released from the follicle in the ovary into the fallopian tube. So you can see the ovarian cycle starting with that follicle starting to grow, and then the egg releasing around day 14. So the egg is now available for fertilization by sperm as it starts shifting through through the fallopian tubes. At this time, you'll see a surge in the luteinizing hormone, which is triggered by those high levels of estrogen, and this causes that release of the egg. So this surge, this luteinizing hormone surge, is a critical indicator of ovulation. So it can be used in pathology to see if you are ovulating at that time. So estrogen is peaking just before ovulation, and then the follicular stimulating hormone also peaks just before ovulation, although not as significantly as that luteinizing hormone. So then we shift into the luteal phase. So the egg has been released, and now it's shifting down through the fallopian tubes, and this is day 15 to 28. So after ovulation, we see the ruptured follicle transforming into the corpus luteum, and this corpus luteum secretes progesterone. And it produces this progesterone to maintain the endometrial lining for the potential implantation of a fertilized egg. So we see that estrogen in the follicular phase being there to support the thickening of the endometrial layer. And then we see the progesterone rising to maintain that endometrial lining for that egg. If fertilization doesn't occur, then that corpus luteum degenerates, leading to a decrease in progesterone, and you can see that significant drop as the corpus luteum starts to degenerate. And then that is what brings that onset of that endometrial lining and shedding of the endometrial lining and menstruation. So in this luteal phase, we see that progesterone rise, and those high levels of progesterone, they inhibit the further release of the follicle stimulating hormone and luteinizing hormone, and this is to prevent the maturation of new follicles during this phase. Estrogen is also produced, but as you can see, it's in a lower level, and it's released by the corpus luteum, again, just helping to support that endometrial lining. Now, it's not on here, but there's another hormone called human chorionic gonadotropin, or HCG, and this only occurs if fertilization has happened. So if a fertilized egg has implanted itself into the uterus, then the developing placenta produces this human chorionic gonadotropin hormone. And this maintains the corpus luteum so it doesn't degenerate, and so that it continues to produce progesterone, which will prevent menstruation. So it's supporting the maintenance of that endometrial lining, and it helps to support early pregnancy. So we see that decline in progesterone and estrogen at the end if there's no fertilization. And then the corpus luteum, by around day 22 to 24, has degenerated, and that's when the progesterone and estrogen start to decline, as you can see in that chart. Okay, so ovulation is the process where a mature egg is released from the ovary into the fallopian tube where it can potentially meet the sperm for fertilization. Now, we've had a little bit of a chat about this, but I think it's important to understand ovulation so that you can know in your own body when you're ovulating. If you're looking for fertility or avoiding pregnancy, it's a good thing to understand. Okay, so it happens around day 14 in a 28-day cycle. And a 28-day cycle is an average. We don't all have 28-day cycles. You may have a 21-day cycle or a 30-day cycle, but if that's a regular cycle for you, then that's your cycle length. 28 is just based on an average cycle length. So the signs of ovulation include a slight rise in your basal body temperature. So this happens after ovulation due to increased progesterone levels. As we discussed, your cervical mucus becomes clear and slippery and stretchy to facilitate that movement of sperm. So you'll notice at that time when you're going to the toilet, you may see some of this mucus on your underwear, or when you're after you urinate and you wipe yourself, you notice that it's like smoother and slipperier. And that is because that cervical mucus is being produced to support fertility. Some women experience mild abdominal pain or discomfort on one side of the pelvis, and this is called middle smirch. Now, if you do have some pain, you need to get that investigated. Middle schmerz is just a mild ovulation pain, and sometimes people will notice that on the left side or the right side. But if you're having any other kind of pain, please go and get that investigated by your doctor. Okay, so during ovulation, the cervix becomes higher and softer. It's your most fertile time for conception. So the most fertile time is typically in the 2 to 3 days leading up to and including the day of ovulation. And this is because the sperm can live in the female reproductive tract for up to 5 days, whilst the egg remains viable for fertilization for about 12 to 24 hours. And remember, I was talking about the crypts within our with our crypts that we have there, that in the cervix, that hold on to the sperm, releasing them at different times to improve fertilization. So therefore, having intercourse a few days before ovulation can still result in conception, because that sperm may remain viable until the egg is released. So if you're looking to become pregnant or increasing your fertility chances, then that is the best time to be having intercourse, because you're maximizing the chance of sperm being present in that fallopian tubes when the egg is released. Intercourse on the day of ovulation can also result in conception. So it's good to be able to track your cycle using methods such as an ovulation predictor kits, or monitoring your cervical mucus, or tracking your basal body temperature to better pinpoint that fertile window. So if you're looking to increase your fertility or avoid pregnancy, tracking your cervical mucus and your temperature is a really good way to discover that most fertile time for you. So if you're wanting to avoid pregnancy, then it's crucial to avoid intercourse during that fertile window, which includes the 2 to 3 days leading up to ovulation and the day of ovulation itself. But if you're using this method without any other form of protection, then it's not going to be 100% viable and guaranteeable. These are just kind of days that you could become pregnant or you could not become pregnant. So please don't use this just as your only form of contraception. Okay, so the hormones involved. Let's have a look now at the hormones that are involved. We've had a little bit of a chat about what they're doing during that 28-day cycle, but let's just have a look at their function within the whole body. So estrogen is involved in the development of our female secondary sexual characteristics. So, our growing of our body hair and our breast tissue, also the regulation of that menstrual cycle and the maintenance of our reproductive tissues. If we have some imbalances within our estrogen, we can see things like weight gain, mood swings, heavy periods, particularly if we've got excessive estrogen in our body. If we have low estrogen, then this can cause irregular periods, hot flashes, and some vaginal dryness. Now, the progesterone, as we mentioned, prepares the endometrium for implantation. It helps to maintain the pregnancy and it helps to balance the effects of estrogen. Any imbalances, such as low progesterone, can lead to irregular menstrual cycles and difficulty maintaining pregnancy. So, as we spoke about, the progesterone helps to prepare and support the endometrium for fertilization. And if we're having low progesterone, then our endometrial lining isn't going to be as thick and as lush as we would like. So, this is where women may see loss of pregnancies in the first couple of weeks as the endometrial lining has difficulty holding on due to that low progesterone. The luteinizing hormone. So the luteinizing hormone triggers that ovulation and stimulates the production of progesterone. If we have imbalances in the luteinizing hormone, we can see, if we have high levels, we can see possible PCOS, so polycystic ovarian syndrome. And low levels can lead to anovulation, which is an absence of ovulation. So if you're tracking your cycle and you're noticing that you're not getting any of that mucus discharge when you should be at that ovulation time, then perhaps you could have low levels of luteinizing hormone, and it's something worth investigating, particularly if you are looking at becoming pregnant. The follicle stimulating hormone stimulates the growth of the ovarian follicles, and it's essential for the maturation of eggs. So high levels can indicate ovarian insufficiency or menopause, and low levels can be a sign of a pituitary gland dysfunction. And we also have prolactin hormone. So the prolactin is what is produced to stimulate milk production post-pregnancy, and it can influence menstrual cycles by suppressing follicular stimulating hormone and luteinizing hormone. So any imbalances in prolactin can cause irregular periods or absence of menstruation. Other important hormones that we have as well is testosterone. So we have it present, but in smaller amounts compared to a male. And this contributes to our libido and our energy levels. And we also have insulin. So insulin imbalances can affect menstrual cycles, especially in conditions like PCOS. So connecting to your menstrual cycle is more than just tracking your period. It's about recognizing and embracing the natural rhythms and changes in your body. So this connection can lead to enhanced well-being, improved health management, and a deeper appreciation for your body's natural processes. So here's why connecting to your menstrual cycle is important. Firstly, it can bring empowerment and self-awareness. So understanding your cycle helps you to become more attuned to your body's natural patterns, including those hormonal fluctuations, energy levels, and emotional changes. By tracking your cycle, you can identify patterns in symptoms such as cramps, mood swings, or fatigue. So this can help you manage and mitigate these symptoms more effectively with lifestyle adjustments or natural remedies. So if you're feeling yourself getting irritable at certain times, and then you can see that perhaps you're in your luteal phase, you're coming up to your menstrual cycle, you can understand where that irritability is coming from if you know where you are in your cycle, and then you can introduce some lifestyle or diet changes or some herbs or supplements to help support the hormones in that luteal phase. Knowledge of your menstrual cycle also allows you to make better decisions around exercise, nutrition, and self-care, aligning them with your body's needs at different times of the month. So, for example, you may not be wanting to go for a 5K run on day one of your menstrual cycle. You may not even want to go to work on day one of your menstrual cycle, but sometimes that's not an option for all of us. So, day one of your menstrual cycle is a great time to really rest and relax and support your body whilst it's shedding that endometrial lining. So if you're understanding what's going on, then you can exercise appropriately, eat the foods that your hormones are wanting at that particular time, and really look after yourself. Also, this understanding of these phases of your cycle can assist in balancing your hormones through diet, exercise, and stress management, because stress plays a huge part in particularly in our lead up to our menstrual cycle and in our menstrual cycle. And in our bleeding phase. So, for example, consuming foods rich in magnesium and B vitamins can help with that alleviation of any of those PMS symptoms that you may be feeling. Understanding and connecting to your menstrual cycle can also improve your body confidence. So, recognizing and accepting the normal variations in your cycle can help to foster a positive body image and reduce the anxiety related to menstrual health. So, really embracing your entire cycle. And I know that sometimes, our bleed can come at inconvenient times, but really embracing all parts of our menstrual cycle can help improve that body image and reduce our anxiety. Regular tracking can also help to identify irregularities or changes in your cycle that might indicate underlying health issues. So if you come to see a naturopath, we're definitely going to ask you about your cycle. And if you've been tracking your cycle, it can really give us a great insight into what your hormones are doing and how your body is reacting to those hormones. So you may pick up we may find some underlying PCOS or endometriosis or thyroid issues that are causing changes and irregularities in your cycle. And as we've also mentioned, knowing the phases of the cycle can be beneficial for you if you're trying to conceive or if you're trying to avoid pregnancy by indicating that fertile window. Incorporating self-care practices that align with different phases of your cycle, such as that gentle exercise during menstruation and more vigorous activity during the follicular phase, can enhance your overall health and well-being. And being knowledgeable about your cycle empowers you to advocate for yourself in medical settings and seek appropriate care if needed. And this is why I am so passionate about education in women's health and understanding your whole body so that you can go to the doctor if you need to and say, I'm having these issues. I think this is what's going on. This is my cycle. This is unusual. And you can have more of a say about what is happening to you and your health. So if you are feeling like something is going on, perhaps you've got heavy bleeding and pain, and the doctor says, okay, I would like you to go on the pill. You can be like, no, I don't want to go on the pill. I want you to find out why I have heavy bleeding and pain, because something is underlying these causes. And so that's why I'm so passionate about this education to empower you to advocate for yourself. So a few practical tips for connecting with your menstrual cycle. So tracking your cycle with an app app. You can use a menstrual calendar if you like you can write it on your calendar physically, or you can use an app. I use an app called Flow. It does tell you that you have to pay for it, but there's a little X in the corner and you can just like exit out of it and you can get a free version. It doesn't show you everything, but it does track your cycle for you and let you know when you're ovulating, let you know how you may be feeling or what's going on for your body at that time. And it also indicates when you can expect your bleed. Taking notice of how you feel during each phase. So, taking notice of your symptoms and your moods or any other observations. Are you more tired at this time? Do you have more energy? And then you can really connect into what's happening in your cycle. So, during your menstrual bleed, you may feel more fatigued. During ovulation, you will probably feel more energized and beautiful. So really taking notice of how you feel during each phase is a really great way to connect in. So practicing that self-care. So trying to adjust your self-care routine based on your cycle phase, as we spoke about, such as engaging in those restorative activities during menstruation. So perhaps you're doing some beautiful, gentle yoga, or just some meditation or some journaling, and then being more dynamic during that follicular phase. Joining communities or groups focused on menstrual health to help share experiences and gain insights from others, or start your own women's circle to support your local community, or perhaps you get a group of friends together and you meet regularly for a chat about your cycle. So lunch and a chat with friends and talking about menstrual cycle. This is about not only just connecting into the menstrual cycle for yourself, but also about breaking that stigma surrounding menstrual cycles and particularly our bleed. So understanding and openly discussing menstrual health helps to break down that stigma and that misinformation surrounding menstruation. And it's going to foster a more informed and supportive environment for us as women. So thank you for listening. I hope that you have really gained an insight into your own menstrual cycle. If you have any questions, please feel free to send me an email or message me on one of the socials. I'm here to support you. If you didn't understand anything and you need some more information, again, please just contact me and let me know. These are my details of where you can contact me and where you can find me. If you're wanting to book in for a naturopathic consultation or a women's circle, you can go through my website and find everything you will need in there. So thank you again, beautiful goddesses, and I hope you have learned a lot about your menstrual cycle and connecting in with your menstrual cycle.